the latest cases of pneumonic plague are mainly out of those two towns, Antananarivo and Toamasina. In total, 33 districts are now affected.
Over 3/4 of the cases reported are the pneumonic type, so the transmission of which is from one person to the next through coughing, through respiratory transmission.
As of this morning, we have been reported 561 cases and 57 deaths. Again, just to reconfirm what Julie also said, more than 2/3 are now pneumonic cases, so we have a count of 70%, and that's what makes it so dangerous.
We've seen a doubling in cases over the last week. Some of that rise in cases will be due to the reporting system having been strengthened. And of course, not all the cases reported are indeed confirmed. However, what we are seeing, though, is a very concerning upward trend in terms of numbers of cases.
Ministry and WHO and partners are training additional 1,800 to speed up the response, to sensitize people, because that's one of the critical issues, that people know of the opportunities, of the possibilities, and of the need for speed in this case to respond as early as possible and seek help. So far, we have luckily not seen anything of resistance, but that is, of course, why we're heavily advising against self-medication. People are stacking up with antibiotics, which in general is not a bad thing to have them ready if needed, but again, on the advice of a healthcare provider and on the advice of a doctor. So just taking antibiotics for the sake of it would not help, and actually would heavily increase the risk of antimicrobial resistance. WHO advises against any restriction on travel or trade with Madagascar based on the current information available.
I was wondering if there's any idea, warning